Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Over 50% of patients admitted in hospitals have a palliative care need. However, in Uganda, just under 10% of these patients will receive the palliative care services. Today on the Doctalk show, we discuss palliative care medicine and its role in today's society. With me in studio, we are pleased to host Ms. Chiwanuka Rose, who is the country director of the Uganda Palliative Care Association, and Dr. Turihikayo Jack, a physician and palliative care specialist from Mulago Hospital. You're most welcome to the show.
Thank you, Dr. Darius.
Yes, you're most welcome. And I am your host again for the evening, Dr. Darius Wachi. So let's dig into understanding more about palliative care medicine, what exactly it means, who will need this service. So, Ms. Rose, you have over 25 years experience in providing palliative care medicine to Ugandans. However, not many people understand what it is. So what is palliative care medicine?
Thank you very much, Dr. Owachi. Palliative care is a service that is given to patients with life-limiting illnesses with an aim of giving them hope, comfort, and good quality of life. That's what palliative care is about. But we don't look after the patient only, we also look at the entire family. Because when a patient is sick, the entire family is sick. Therefore, it's important that you look at the entire family together with the patient.
So you mentioned that palliative care medicine goes beyond the patient. You bring in the aspect of family, the caretaker's involvement. How is palliative care able to combine all these factors? We thought medicine is all about the patient and getting better. Dr. Jack, how is it that palliative care combines these?
Thank you, Dr. Darius. Maybe for starters, I also want to clarify about life-limiting illnesses that Rose did talk about. Mainly, we regard these to be chronic conditions that are usually not curable and eventually progress and might lead to death. And in there, we include diseases such as cancer, diseases such as strokes, diseases such as organ failures, for example, heart failure, renal failure, kidney failure, and many others. We know in palliative care that actually dying is a process. It's not an event. And therefore, at the time these diseases are found out or diagnosed, ideally that's when palliative care should be started. And in there, we try and address the patient's problems, which might be in different dimensions of their lives. They might have physical problems, psychological, social, or even spiritual. As disease advances, what we actually know is that more of the problems become non-physical. So you have more patients who have spiritual distress, who have social problems because probably their disease has drained their finances and their family supports have dwindled. And then many will suffer from psychological distress of suffering with disease as it advances.
And that's where palliative care comes in to tackle the other aspects of a patient's life, not just the actual physical disease.
Exactly. And that's why we are saying that even the family members need to be supported, need to be looked at. Because remember, as they are caring for this patient, they are also losing a lot of things. You could lose your job as you care for this patient. You need somebody to talk to. You can no longer go to your farm to dig because you're looking after this patient. And some of them get tired. They get burnt out because this patient has been sick for the very long time, is bedridden, you don't get the opportunity to do your work the way you used to do. Therefore, the family members also need to be talked to.
Okay. And it's a very important field of medicine which helps to tackle the needs that you're talking about. Yeah. Dr. Jack, you highlighted on them. So how long has palliative care been in Uganda?
Palliative care was brought to Uganda by Dr. Anne Merriman, who is the founder of Hospice Africa Uganda, in 1993. And I happened to be the first nurse to join palliative care in 1994. I realized that actually palliative care was the best approach for all healthcare workers to give our patients comfort.
Why do you say it's the best approach? How is it different from the, I would say, the traditional
medicine? Why I say it is the best, you're looking at a person as a whole. You're not only focusing on curing the patient. The patient may come to hospital with lots of other problems, and if you're just going to focus on the symptom, that may not be enough. You need to look at these patients' social needs, psychological needs, spiritual needs, and physical needs, because all those aspects impact on the patient's physical pain.
And in order to improve their quality of life.
Yeah.
Okay, that makes it a very important part in any health system. Yeah. Okay, so in that case, who exactly needs it? Is it only people who are going to die? You mentioned people who have cancer.
Right.
Those are the only people to receive palliative care?
I think it's a misconception that palliative care is needed by people who have cancer only. But there's a lot of people who have what we call palliative care needs. And we've offered palliative care for patients, for example, who have advanced HIV, patients, as I mentioned earlier, who have organs that have failed, and they have really, really many symptoms that they are struggling with. There are also a number of degenerative conditions that affect the brain, such as dementia. All these are conditions that are progressive in nature, and they are likely to cause a death to this patient in the future. And that's, and that's the whole purpose of palliative care. We understand in the medical profession that the concept of death is present, but we also want to keep our patients in good quality of life, even as they struggle with disease, as they fight with disease. We wouldn't want patients to die in pain, to die in agony. And so that...
You want them to have at least a good quality towards the end.
Absolutely.
Okay.
And also something peaceful that is memorable for the family.
Exactly. Yes. And this patient having comfort gives the family members also comfort to continue caring for their patients. Much as they may know that actually death is coming, but giving them that hope there will be something to be done, much as this patient has a life-limiting illness, has a chronic illness, I think gives the family that comfort and that peace to continue caring for their own patient.
Okay, so comfort, peace, having a quality of life, these are some of the goals that palliative care medicine aims to achieve in our healthcare system in Uganda. It's a bit of a new system. I know there might be some challenges along the way. Not many people might understand it.
Right.
But that's why we're having this discussion to help raise awareness about palliative care, where we can access it, who needs it, and if possible, what is provided under palliative care. So after the break, we'll come back to address some of these issues. Send your questions, your comments on our social media platforms. Don't go away.
You are watching the Doctalk Show.